everyone, and welcome back to my channel. In this video I just want to talk about the reasons why do babies cry while breastfeeding. Babies cry while breastfeeding for several reasons, and that don't just happen. Remember, babies like breastfeeding, and once your baby starts crying while breastfeeding, put it in your mind that is not normal. There is something you should take a serious look on it, so that life is going to be easier for you at the same time for the baby. But if at all this is your first time to click on my channel, please kindly subscribe. I'm Sharat, and I'm a breastfeeding mother and a travel blogger. So I want to take you through a lot about breastfeeding, about motherhood, about nursing, and other maternal things. So today I want to talk about the reasons why do babies cry while breastfeeding. Babies cry, number one, while breastfeeding is the first thing why they cry. They cry because of a low supply. Once the milk is not enough for the baby, they will definitely cry. So always make sure that they have enough milk while you're breastfeeding them. So always make sure that you increase your breast milk supply as a breastfeeding mother, because this is very important and it's going to help your baby gain enough weight, and as well it's going to make you lose weight as well. So another thing I'm going to talk about, fast supply. When you have a lot of milk and the baby is still little, remember the baby's tummy is tiny. The tummy is very tiny. Always make sure that you have enough supply. Do a good latch and hold the breast like this, so that you're going to be stopping some of the pipelines which are used to release the breast milk. So place a little bit of your breast and make sure that you don't release too much milk to the baby. This is going to help your baby have enough milk, which is enough for the baby. And remember, the faster supply, the more the milk gets hot, so that will also make your baby cry. Another thing I'm going to talk about, oral thrush. Some babies, they happen to be having oral thrush wounds on the tab. So always make sure that you get a white cloth, a cotton one or a cotton wool. Then get sugar or get oil, boiled cooking oil. Then you can start rubbing them off on the baby. Get something this ear bags. Then you start washing your baby's mouth, so that they are going to find glycerin for the oral thrush. You can wash it with the glycerin, but still, even the glycerin, you have to use that method of washing it off of the baby's mouth, because at times they have that oral thrush infection. They have to be taking medicine, but still you have to wash the baby's tongue, so that the baby will not be getting peptic ulcers. So another thing I'm going to talk about, a dirty diaper. So once the diaper is hot, the baby happen to be getting burnt down. So in that case, the baby will be crying all the time. So always make sure that you check the diaper before starting breastfeeding your baby. Some babies, they cannot breastfeed when they are dirty. So always make sure that you check your baby before starting breastfeeding your baby. So another thing I'm going to talk about, the room temperature. So the room temperature, if at all the room temperature is high or very cold, this is going to be making the baby uncomfortable. In that case, the baby won't be able to breastfeed. Always make sure that you check the room temperature, so that if it's very cold, reduce the baby's clothes. If it's very cold, make sure that you cover the baby with warm clothes. But if at all it's very warm, make sure that you reduce the baby's clothes and make it lighter for the baby to have a comfortable atmosphere, have a comfortable surface. So another thing I'm going to talk about, illness like cold. Put it at your side before you put it on the side of the baby. If you have cold, at times you happen to have headache and fever at the same time. Sucking, it's very hard. So whenever he sucks like this, it comes here. Whenever the baby sucks, it's like he's taking the drinks to here. So always make sure that you treat the cold before you think of why the baby is crying. Make sure that you check your baby time to time. Another thing, it's breastfeeding the baby when the baby is full. So make a schedule for your baby. Know the time that my baby is now full and learn how to stop in the right time. So some of the mothers, they like breastfeeding their baby as frequently, time every after 30 minutes. Babies are not like this. Remember, they have little tummy, so you're giving them more than to their average. So always make sure that you check the time. Make a schedule for your baby so that you're going to be breastfeeding your baby in the right time. Because those are the challenges of breastfeeding. Because once the baby starts crying, the thing becomes hard. So another thing, toothing. When the baby they start toothing process, in that case, trust me, they are going to stop breastfeeding. Because the roots are paining, hurting, like they're itching. So they feel like biting time to time. So when they think of breastfeeding, they think of biting. That can also make the baby cry whenever they try breastfeeding, because when they try breastfeeding, they feel like they want to bite. So guys, those are all for today, but really love you. Can't wait to see you in the next video. Love you all. Ciao ciao.